Um, did you know that over 80% of strokes and heart attacks are not caused by cholesterol or calcium buildup in the arteries, by blood clots, a silent killer that can form in just 5 seconds? This shocking information has been widely shared on X recently. As a cardiologist warned, don't blame cholesterol. Blood clots are the real culprit behind millions of deaths every year. According to statistics from health organizations discussed on X, there are over 32 million cases of strokes and heart attacks worldwide each year, and the number is rising, especially among young people. In Vietnam, more than 200,000 people suffer from strokes annually, with 50% not surviving. The alarming fact is that many people still mistakenly believe that lowering cholesterol alone is enough to protect their heart. But the truth is, if you don't control blood clots, you are still at high risk of facing life-threatening events. In this article, we will uncover the real causes of blood clots, the risk factors for strokes and heart attacks, and most importantly, the effective prevention methods to protect you and your family's health in 2025. If you're interested, watch our detailed video for a deeper understanding. Don't forget to like, subscribe, and turn on notifications for more valuable health insights. What are blood clots and why are they so dangerous? Blood clots, a natural mechanism that can turn deadly. A blood clot is part of the body's natural defense mechanism. When an artery is damaged, such as a small tear in the blood vessel wall, the body activates the clotting process to patch the injury and prevent excessive bleeding. Ideally, the clot should dissolve once the wound is healed, allowing blood to flow normally again. However, when this process is disrupted and the clot does not dissolve but continues to grow, it can block arteries, leading to ischemic stroke or heart attack. According to a user on X, a cardiologist explained, blood clots can form in the heart or anywhere in the body, then travel to the brain or coronary arteries, causing sudden blockages. The real danger is that this process can happen within seconds, leaving little to no time for reaction if not detected early. Types of strokes related to blood clots. According to medical sources shared on X, there are two main types of strokes caused by blood clots. Thrombotic stroke. A blood clot forms directly in a brain or neck artery, usually due to atherosclerosis, narrowing of the arteries caused by plaque buildup. Embolic stroke. A blood clot forms elsewhere, often in the heart due to atrial fibrillation, and travels to the brain, blocking blood flow. These two types account for 85% of all strokes, while the remaining 15% are hemorrhagic strokes, which occur when a blood vessel in the brain bursts. One user on X shared, I used to think strokes only happened to older people, but my friend had a brain infarction at just 35 due to a blood clot from atrial fibrillation. Don't ignore the risks. Want to learn more about how blood clots form and how to detect them early? Watch our video for a detailed explanation with live illustrations. Factors that increase the risk of blood clots. Chart 1. Smoking and exposure to pollution. Smoking is one of the leading causes of artery inflammation and blood clot formation. Cigarette smoke contains thousands of toxic chemicals that damage the artery lining, making it easier for clots to form. A user on X warned, smoking doesn't just cause lung cancer, it increases your risk of stroke by 4 times. In addition, air pollution and environmental chemicals have similar effects, especially in large cities. Solution: quit smoking today. Avoid exposure to polluted air by wearing a mask and choosing to live in areas with cleaner air. Nagrish 2. Alcohol and stimulants. Alcohol, cocaine, and other stimulants are considered toxins to the liver and circulatory system. A health expert on X stated, alcohol increases arterial inflammation and triggers blood clotting, especially when consumed excessively. Cocaine and amphetamines can also cause coronary artery spasms, significantly raising the risk of heart attacks. Solution: limit alcohol intake and completely avoid stimulants. If quitting is difficult, drink in moderation and only occasionally. 3. Birth control pills and hormone therapy. Women who use birth control pills or hormone replacement therapy, HRT, have a higher risk of blood clots due to hormonal effects on clotting mechanisms. A user on X shared, I developed deep vein thrombosis after taking birth control pills for 2 years. Luckily, I caught it early. Otherwise, it could have led to a stroke. Solution: consult a doctor for safer, non hormonal alternatives such as IUDs or other birth control methods. 4. Psychological stress and broken heart syndrome. Chronic stress increases cortisol levels, triggering inflammation and blood clot formation. A widely discussed phenomenon on X is broken heart syndrome, where losing a loved one can increase the risk of a heart attack by up to 2,000%. One user wrote, "My mother had a heart attack after my father passed away. The doctor said extreme stress caused the blood clot." Solution: practice meditation, yoga, or relaxation activities. Spend time with family and friends to manage stress effectively. Fact 5. Refined carbs and high blood sugar. A diet high in refined carbohydrates, white bread, sugary foods, promotes arterial inflammation and makes blood thicker, especially for diabetics who have 4 to 5 times higher risk of blood clots. One user on X shared, "I have diabetes and suffered from deep vein thrombosis. Since cutting out sugar and refined carbs, my health has improved significantly." Solution: switch to a low carb, ketogenic diet, eat more vegetables, and reduce sugar intake. 6. Infections and chronic inflammation. Chronic infections, such as dental infections or endocarditis, can significantly increase the risk of blood clot formation. A dentist on X warned, "Don't ignore cavities. Bacteria from your teeth can enter the bloodstream, causing inflammation and triggering blood clots." Solution: schedule regular dental checkups and treat infections promptly. 7. Excess calcium and other risk factors. Postmenopausal women who take excessive calcium supplements may experience arterial calcification, which contributes to blood clot formation. Additionally, surgery, endurance sports like marathons, and cardiovascular conditions, atrial fibrillation, heart failure, can further elevate the risk. Solution: take calcium in moderation and consult a doctor before supplementation. Want to learn more about these risk factors and how they affect heart health? Watch our video for detailed explanations and easy to understand illustrations. Effective ways to prevent blood clots in 2025. Blood clots are a silent killer responsible for most strokes and heart attacks. Preventing them requires lifestyle adjustments, proper nutrition, and smart supplementation. Here's how you can protect yourself. 1. Use vitamin K2 and vitamin D. Vitamin K2 prevents calcium buildup in arteries, keeping them flexible. A user on X shared, "I started taking vitamin K2 with vitamin D after discovering artery calcification. After 6 months, my health improved significantly." Tip: add butter, cheese, and egg yolks to your diet for vitamin K2. 15 to 20 minutes of sunlight daily for vitamin D. 2. Boost magnesium and nitric oxide. Magnesium regulates calcium and prevents abnormal blood clotting. Nitric oxide, NO, dilates blood vessels, improving circulation. A nutrition expert on X suggested eat red meat, liver, and leafy greens to increase NO. Sun exposure also boosts NO naturally. Tip: eat almonds and spinach for magnesium. Spend time outdoors for natural NO production. 3. Low carb diet and intermittent fasting. A low carb diet and intermittent fasting, if help reduce inflammation and improve blood viscosity. A user on X shared, "I switched to keto and intermittent fasting, 16/8. In 3 months, my blood sugar stabilized, and I no longer worry about blood clots." Tip: try the 16/8 fasting method and replace refined carbs with greens, fish, and poultry. 4. Use nattokinase. The Japanese secret, nattokinase, an enzyme from fermented soybeans, natto, is proven to dissolve blood clots. A user on X shared, "I took nattospez, nattokinase supplement, daily after a minor stroke. My health improved within 2 months." Tip: take nattospez, 4 capsules day as advised by a pharmacist for effective prevention. 5. Light exercise and a healthy lifestyle. Walking, yoga, and swimming improve circulation. Avoid smoking, limit alcohol, and maintain a healthy weight. A user on X shared, "I started walking 30 minutes daily after a deep vein thrombosis. Now I feel much healthier." Tip: walk or do yoga for 30 minutes a day, at least 5 days a week. Conclusion: take action to protect your heart in 2025. Blood clots cause over 80% of strokes and heart attacks. Knowing the risk factors from smoking, stress to high blood sugar, and using preventive measures like vitamin K2, nattokinase, and a healthy lifestyle is key to heart health. Start today. Watch our video for detailed guidance and easy to follow tips. Don't forget to hit like, subscribe, and turn on notifications for more valuable health insights. Got questions about stroke prevention? Drop a comment below. We'd love to hear from you.